everyone. I'm Shelly Argabright, health strategist for Garrett County, and I'd like to welcome you to our 4th population health update. It is finally spring, and our children have returned to school campuses, and there's a steady pace of vaccine being distributed in the county. So that brings some relief as well as some energy. So speaking of energy, do you guys get to see this article about Jen Sober and her studio at Fit with Jen? If you haven't, please check it out. Fit with Jen is one of the local businesses that signed on very early to Go Garrett County, and we've been able to highlight her and the work that she's doing there for our community. Since January 3rd, we've had over 3,000 visitors on Go Garrett County and over 20,000 page views. So this is a really great example of a well-being program that is actually relational marketing, and it's working very well. So if you're a business, if you know a business owner, if you're part of a club, a faith-based group, or you have something to share that you feel would improve well-being, please reach out and we would love to feature you. So we've had a tremendous amount of physical activity on the site this past month. We started out with some spin classes at Jen's. Then we popped over to Jazzercise and we had a mini workout with resistance bands. We learned about Lisa Malone's light class, and we finished up with some exercises and demos from Haley about optimal weight. So why so much exercise? We all know it's really good for us. We know that it can help prevent heart disease, diabetes, certain cancers, and it can even help prevent some symptoms of depression. So why is it so easy to avoid? If you missed Haley's video from her top 10 suggestions, I invite you to go back and watch that video. And if you've already watched it, watch it again. I'm asking that everyone make a commitment now that it's springtime to really get moving. Our population health data suggests that, continues to suggest that we need more physical activity. So if you watch that video from Haley, it will help you get started on the right foot. Okay, so some other things that we're going to do today in our population health update is actually draw a prize winner. And you guys remember the Go Outside and Capture It campaign. We asked that you send in videos of yourselves doing things that you like outside, and we would give you 25 extra points, and then you would be chosen. One of you would win this Kindle Fire. So today, I have all the names of the people that participated loaded up into my computer, and we're going to use a thing called wheelofnames.com, and I'm going to do this live. So we're going to just go ahead and draw for that. I'm going to hold this up awkwardly. Push the button and see who wins our Kindle Fire. It looks like Keela Path. It even provides some applause for us, so thank you, Wheel of Names. And Keela, I will get in touch with you so that you can receive your new Kindle. Never fear, if you missed this one, we are going to announce another spring version of our Go Outside campaign really soon. So that's something to look forward to and something to watch for. Some other things to watch for on the site are new prizes. We're going to highlight some tokens that you're able to get from Garrett growers for actual veggie boxes. So that's going to start in April. And we're working with the University of Maryland Extension and Garrett growers to create a series of videos about those veggie boxes, how to preserve the food and make some really delicious recipes. So that's going to be exciting. Also, the Western Maryland Food Council is going to help with some of that. Be sure you don't miss their conference. It's this week, and I'll put the information below so that you can join that if you'd like to. A couple other things about your calendar. Also this week, we're having our Health Planning Council, and the public is invited to that and encouraged to attend. It will be a virtual meeting. So I'll put the link below. This month, we're going to talk about opioid, the prevention, intervention, and treatment. There'll be some guest speakers, and we'll also have a COVID-19 update from our health officer, Bob Stevens. So traffic on my Garrett County has been very high. Part of that is due to the Population Health Innovation and Informatics Unit collecting some data to get ready and publish our Community Health Improvement Plan. So people are busy updating their groups, making sure all the information is in there so that they can be included in that really important strategic document. There's also been a few new groups added, and so to continue with our theme, there's a group about physical activity, and it is called the Healthy Weight Work Group. I'll also put those links below. And primarily right now, it's made up of medical practices who have made a commitment and are interested in really reducing obesity in our children. So be sure to continue checking garretthealth.org for the most current updates about COVID. As Maryland opens up vaccine eligibility, those of us who have been waiting patiently continue to edge a little bit closer. And in closing, with all of this energy and the feeling of spring, we really just have to make an effort to be diligent and continue making safety a priority. Proper social distancing and proper mask wearing over your nose and mouth are really important. We're already a year in, and COVID is still very much with us. So please remain responsible. And did I mention that physical activity helps deal with frustration and stress? So get outside, get moving, and stay healthy and safe, and we'll see you next time.